Start. Welcome back guys. Now let's see the cross section of the spinal cord. See, in the cross section of the spinal cord, what you can see. Can you appreciate this central area, the central head-shaped area, which is light grey in color? So, this central head-shaped area or butterfly-shaped area, this area is called as a grey matter. Okay, in the cross section of the spinal cord, what we can see in the center there is grey matter, guys. And this area which I am highlighting here, this is called as a white matter. So, there is a central grey matter and peripheral white matter. Now, you will be having it out. Sir, what exactly this grey matter means? What is the meaning of the word grey matter? Okay, let me write here. Guys, write grey matter. Grey matter meaning, the meaning of the word grey matter is equal to collection of cell bodies of what? Of neurons. Collection of cell bodies of the neurons is called as a grey matter. So, what you can see in the grey matter, it's all the cell bodies, guys. These are the neuronal cell bodies. Here you are seeing the neuronal cell bodies. These are the collection of neuronal cell bodies. Okay, these are the neuronal cell bodies. Now, students will start to have it out. Sir, if a neuron is having a cell body, then where is the axon? What about the axon? So, the axons are coming here. Look, this is a neuron and here is the axon. So, axons are coming where? The axons are coming into the white matter. So, what is the white matter? Now, tell me, white matter is nothing but the axons of the neurons. So, write here the white matter. So, what exactly is white matter meaning? White matter is collection of the axons of neurons. And white is white in color because of the myelination, myelin sheath. Okay. So, finally, you know, the grey matter is nothing but the cell bodies of the neurons and white matter is nothing but the axons of the neurons. Okay. Now, let us see the parts of the grey matter. Parts. Guys, this area which I am highlighting, this is the back side. Okay, that is the dorsal side. And this area is the anterior side. Okay. So, spinal cord, in the spinal cord, there is a dorsal side and there is a ventral side. So, now on the dorsal side, okay, let me write here, this is dorsal and here it is ventral. Now, on the dorsal side, can you appreciate these horns? The two horns, like you know the horns for a buffalo. So, these horns which are there on the dorsal side, they are called as the dorsal horns, and anteriorly there are ventral horns. So, two dorsal horns are there and two ventral horns are there. Okay, fine. Now, what about the white matter? Let us divide the white matter into parts again. So, here there is white matter. This is also white matter, sir. So, white matter is divided into dorsal column. Here is the dorsal column. Here is the anterior column and these are the lateral columns. There are two lateral columns, guys. So, now grey matter is divided into dorsal horns and ventral horns, and white matter is divided into dorsal column, lateral column and anterior column, you can say, or ventral column, you can say. Now, the first point is, sir, ventral horns are motor in nature. Dorsal horns are sensory in nature. Okay. So, dorsal horns are always sensory, ventral horns are always motor. Now, why I am saying this? Dorsal horns are sensory and ventral horns are motor. Students will start to have a confusion. Let me give you the clarity, absolute clarity. Guys, look carefully. Let us start from here. Okay, from the basics. Here is your skin, let us say. Here is your skin. This blue color thing is your skin. Now, someone is coming and touching you. Okay, someone is coming and touching you. Touch stimulation. Okay, touch. Now, whenever someone is coming and touching you, who is going to be activated in your skin, guys? It's the receptor. Receptor will be activated. Now, tell me, these receptors are going to give the information to a neuron. Now, tell me, what is this neuron? This neuron, is it a sensory neuron or motor neuron? What do you think? So, whenever someone is coming and touching you, the receptor is activated. The receptor is going to send this information to the sensory neuron. So, sensory neuron is taking the information towards the brain. Okay, someone is touching. So, look carefully. Here is the sensory neuron going like this. And this is the place where the cell body of the sensory neuron is present. Okay, here is the cell body of sensory neuron. So, this area, okay, little bulge is there, right? So, this is the place where the cell bodies of sensory neurons are present. So, this area is called as a dorsal root ganglion. So, now tell me, what exactly is the dorsal root ganglion? See, the word ganglion means a collection of cell bodies in the peripheral nervous system. See, the collection of cell bodies of neurons in the central nervous system. The collection of cell bodies in the central nervous system is called as grey matter. In the same way, the collection of neurons in the peripheral nervous system is called as a ganglion. Okay, we will discuss that. But first now tell me, what is there in the dorsal root ganglion? Sir, in the dorsal root ganglion, it's the cell bodies of sensory neurons are present. Okay, fine. Now, where do you think the sensory neuron is going? See, this sensory neuron, it is taking this touch information. See, this sensory neuron, it is coming like this. And through this dorsal roots, these areas are called as the dorsal roots, guys. These are called as what? These are dorsal roots. So, through the dorsal roots, the touch information is finally coming into where? To the dorsal horn. So, finally, where the information came? The information came into the central nervous system. That's the spinal cord. Information finally first came to the spinal cord. Later from here, it will go to the brain. That we will discuss later. But first, tell me, whenever someone is coming and touching you, first the information has to go to the spinal cord. Okay? Now you understand? So, from today, if someone is coming and touching you, touch, pain, temperature, pressure, what not, all the sensations, from here, with the help of this sensory neuron, first it will enter into the spinal cord. Which part of the spinal cord? It is entering into the dorsal horns. It's entering into the dorsal horns of the spinal cord. So, that's why the dorsal horns are sensory. Now, you understand dorsal horns are sensory. Okay? Now, okay sir, finally someone is coming and touching you. What do you have to do? You have to respond, right? You have to give the response. Either you have to hug him or slap him, you have to do something, movement. For that, which neurons are required? Motor neurons are required. So, from where the motor neurons are beginning? Sir, the motor neurons are beginning from the spinal cord. Okay, from which part of the spinal cord? From the ventral horn. We know this is the ventral horn. So, from here the motor neuron is beginning. So, this motor neuron, okay, this motor neuron, look, it is coming out like this through the ventral roots. Through the ventral roots, it is coming out like this, and finally, where is it going? It is going to the muscles. It is going to the muscles, helping muscle contraction. Okay, helping in muscle contraction. So, what I am trying to say, guys, these are the motor neurons. The motor neurons are coming out of the ventral roots. These are the ventral roots. Through the ventral roots, it is coming out and it is going to the appropriate muscles, causing the muscle contraction. So, whenever the muscles are contracting, you can give the response. Either you can hug him or slap him. So, what I am trying to say, guys, there are sensory neurons going towards the central nervous system and there are motor neurons coming out of the central nervous system. Tell me, the dorsal roots, these are the dorsal roots. No, these areas, these are the dorsal roots. Tell me now, dorsal roots are sensory or motor? Sir, all these dorsal roots are sensory. And what about the ventral roots? These ventral roots are motor. Now tell me, the dorsal roots from posterior side and the ventral roots from anterior side, the dorsal roots from posterior side and the ventral roots from anterior side, they are coming together and forming this one single structure. See, they are coming and forming this one single structure. So, you have to tell me what is this structure? What is this? That's nothing but your spinal nerve. So, here is your spinal nerve. From the spinal cord, who is coming? This is the spinal cord. No. From the spinal cord, who is coming? That's the spinal nerve. Have I taught you? Your spinal nerves are both sensory as well as motor. Information is going towards the central nervous system and information is coming out of the central nervous system. Dorsal side is always sensory, ventral is always motor. But tell me, what about your spinal nerves? Spinal nerves are mixed. Spinal nerves contains a sensory neuron as well as the motor neuron. You understand? See, roots are pure. Dorsal roots are purely sensory. Ventral roots are purely motor. But what about the spinal nerves? Spinal nerves are mixed. Spinal nerves contains both the sensory neuron as well as the motor neuron. Information is going towards the central nervous system. Information is coming out of the central nervous system. Okay, now you understand? See, let's write some important points about the spinal cord, which will be asked in your exam. Sir, spinal cord, from where it will begin? In children and neonates. Okay, adults and children, let's say. See, it's going to begin from C1 vertebra. Okay, C1 vertebra. Okay, so the spinal cord is going to begin from which vertebra? C1 vertebra. And it's going, see, in neonates, it's going to be up till L3. In adults, it's going to be up till L1. Okay, L3, L1. L1 stands for lumbar vertebra. So, this is the length of the spinal cord in adults, in children. C1, lower border, L3, upper border. Okay, extending up till here. What about the dorsal roots? Have we already taught you? The dorsal roots are always sensory. What about the ventral root? Ventral roots are always motor. Okay, but what about the dorsal horn and ventral horn? Guys, the dorsal horns and ventral horns, they are also, the dorsal horns are always sensory because they are receiving the sensation. Ventral horns are always motor. But wait, what about the spinal nerves? Dorsal roots are sensory, ventral roots are motor, but their combination, the spinal nerve. Spinal nerves are always mixed. Spinal nerves are always mixed. This law is called as Bell-Megendis law. Bell-Magendis law. So now tell me what exactly is Bell-Magendis law, guys. Bell-Magendis law states us the dorsal roots are sensory, ventral roots are motor, but all the spinal nerves are mixed in nature. Okay. Now let me tell you some clinical importance. How to understand this? Imagine today I am coming and damaging your dorsal horns. Let's say I am totally damaging this part of the spinal cord. These horns are getting damaged. So what you will lose? You will lose the sensation. You can't feel anything. Whatever I am coming and doing to your body, you can't feel it because the dorsal horns are damaged, because the dorsal horns are receiving the sensation. Okay. Now imagine there is a virus. Now try to understand. There is a virus which is coming and growing in this part of the spinal cord. Which part? It is living in the ventral horns and causing the damage to the ventral horns. It is replicating and causing the damage to the ventral horns. So now tell me what will happen? Sir, when the ventral horns are damaged, your sensations are okay. You can feel the sensation, but you can't do the movement. You can go into the paralysis. So when the motor neurons are getting affected, tell me, when the motor neurons are getting affected, do you think your muscles can contract? No, you can't contract your muscles. Without contracting the muscles, you can't have the movement. That will lead to paralysis. So right, there is a virus, okay, causing damage to ventral horn. There is a virus that's causing what, sir? That's causing a damage to the ventral horn. So the patient cannot have the muscle contraction. That will lead to what? Paralysis. That will lead to paralysis. So what is that virus? That's polio. Okay. So from today, you have to remember, you know polio, okay, especially going to be seen in the children, okay, because of taking a contaminated water. Okay, polio is going to like transmit via the fecal-oral route, right? So once you get the polio, okay, once a person gets the polio is going to cause damage to the spinal cord. Which part of the spinal cord? Especially the ventral horns. Ventral horns are damaged means the motor neurons are damaged. Motor neurons damaged means that will lead to the paralysis. So polio virus causes paralysis by damaging the ventral horn. Okay. So with this, what we have completed, we have seen the structure of the spinal cord, the cross section of the spinal cord. The central area is called as the grey matter, which contains the dorsal horn, ventral horns. Dorsal horns are always sensory, ventral horns are always motor. And white matter, what exactly is white matter, guys? White matter is nothing but the collection of axons are there. There are axons, and white matter is divided into dorsal column, ventral column, and two lateral columns. So dorsal column, anterior column, and two lateral columns. Okay. So with this, the cross section of spinal cord topic completed. Hope the video is helpful. Thank you.